Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to be able to have a conversation with Dr. Jaden Lee, who's the Chief Genomics Officer for UGenome. Dr. Jaden Lee, Jaden, I'll just call you Jaden because that's what I call you all the time. Why don't you tell us a little bit about yourself, personally and professionally, before we get the conversation kicked off today?
Nice to meet you, everyone. Whoever is watching this, my name is Jaden. I am a pharmacist by training. I have always been in a clinical side. I had a big passion for primary care, really focusing on preventative care and chronic condition management. But really, through my clinical experience, I really learned about how genetic difference can affect how patients may respond to certain medications or how their medical conditions can progress. So that really got me into sort of pharmacogenomics and personalized medication service. So I am quite excited about, what we can talk about today. And I hope you like what I have to say as well. Thanks.
Great. So maybe just quickly, Jaden, what are the two products you're leading on for UGenome?
So we are currently working on two products. One is called Max. Max can create a customized reference genome, which will help with the downstream work of bioinformatic pipeline. And the other is called ProPax. And because we believe that everyone's going to have their genome sequence at one point, the key to the whole information is really how we can extract the relevant data. And ProPax can actually extract pharmacogenetic data from whole genome and whole exome sequencing data.
Great. Thank you. All right. So the first question, Jaden, is pretty basic. What is pharmacogenomics for the average person who doesn't know about it, has never heard this term before?
So pharmacogenomics is really utilizing the information from your genetic makeup to guide your pharmaceutical care. So it is really to look into your genetic makeup and how that may affect your reaction to drug, and how your body may metabolize the drug. And that will potentially help us to choose the medication that works best for you with minimal side effect. So it's really another tool. We certainly use lots of informations when we try to pick a drug for our patients, and genetic information is just another tool that will help our providers to choose the best medication for our patients. There are lots of drug-gene interactions that really needs to be addressed, and the information on that will certainly help you with choosing the right medication. So really, it's focusing on your genetic differences and how that will guide your therapy.
So, I mean, it sounds a little bit like data science that more people are kind of familiar with. Is it something like data science?
Um, I will say it's not strictly data science, but it's a combination of, I would say, data science, biology, and clinical care. So it is really understanding the biology of human and how the genetic can affect it. Data science is more to do with how we actually dissect and analyze these information together, because this is a lot of information. And we want to also bring in the clinical component where how it can actually be implemented and used in actual clinical care, which is also important. Implementation is always a challenging in healthcare system, so that is definitely another important aspect.
Okay, so one of the things you mentioned earlier about pharmacogenomics is that the starting point is response to medications there. So, do people respond to medications similarly or differently?
So typically, there's a good chunk of patients who will respond well with minimal side effect. But always, if we are thinking about a bell curve, people on the each end of it, they just may not respond the same way. They could have more side effects. The medication might not work at all. So people do respond differently, and we think that genetics play a role in that difference.
Great. Thank you so much. Great. So, Jaden, is pharmacogenomic tests or are these tests worth my time and money? So again, a person who's never heard about this before and they're thinking, well, it'd be interesting to get an at-home test and figure out some of my medications. Is it worth it?
Yeah, as a huge advocate for pharmacogenetic tests, it is certainly worth your time and money. It is so worth it that there is a growing body of clinicians, uh, pharmacists, and the physicians who are promoting and encouraging a preemptive pharmacogenetic test. So in the past, pharmacogenetic test was always done in a retrospective way, but now there's a lot of push for preemptive. So before you even take medications, doing the pharmacogenetic test is really promoted. And it really saves a lot of time because instead of you going to doctor 5, 6, 10 times to find a right medication, you can potentially find a right medication the first time. So it saves a lot of time. Not only that, that will result in cost saving as well, because now you don't have to see doctors so often, because every time you go see a doctor, that's money right there, including transportation and time you need to take out to go to that doctor's appointment. Not only that, you don't have to spend a lot of money on medications that do not work for you. So that is also a good way to save money. And lastly, it's just good for your health. If you think about it, adverse drug reaction is one of the leading cause of hospitalization and deteriorating health. We have patients who are getting severe side effects from medications that lead to a detrimental health conditions as well. So understanding pharmacogenomic and choosing the right medications can also help you stay healthy and avoid any undesirable effects. So it could really have a great impact on your health as well.
Yes, I can certainly attest to our personalized medication service. I did my cheek swab over the weekend, and I filmed every step of myself doing the personalized medication test. And even with all the filming and stopping to document the process, it took me about 12 minutes. So my guess is that the average person is going to open an at-home test kit that we provide, do a cheek swab, not even a nose swab, just cheek swab, which is super comforting. It's almost like a little massage. And then since I sent my at-home test kit in the mail a few days ago, I've gotten like text updates every step of the way. So really looking forward to finding out my genetic profile in terms of my medications, and then finding out which medications I should take or which ones I should avoid going forward. So I'm really looking forward to this, and I can attest on the time and money aspect. It's worth my time and definitely worth my money. So thank you, Dr. Lee.
Yeah.
Great. So next question, and this is a big, big question. Anytime you have a question with the future inside of it, right? It's a big question. So you can take your time and kind of explore this a little bit. So what is the future of precision medicine and pharmacogenomics?
So I think precision medicine will more and more be adopted in healthcare overall. Of course, precision medicine is a sort of a broader umbrella field, and pharmacogenomics is sort of a subset of precision medicine. When we talk about precision medicine, we're really talking about choosing the right medication for that specific individual. We are so familiar with population level approaches, which have shown great benefits in reducing costs for specific population. But we are certainly running into issues where a small subset of a population is just not responding to medications or experiencing significant side effects. So precision medicine, without a doubt, will certainly be a future. And not that it will be a single field, but within every field. So cardiology, rheumatology, immunology, whatever the disciplinary we're talking about, within that, there's going to be a push for precision medicine. And of course, pharmacogenomics will certainly help with choosing the right medication for that patient. We are increasingly becoming knowledgeable that every individual is different. So one size fits all does not work. So we want to tailor treatment for each individual, and pharmacogenomic is the one of the tools that could potentially help with that. So I only anticipate that the pharmacogenomics will be adopted more and more throughout the healthcare in the future.
So Dr. Lee, Jaden, how do providers choose a drug for a patient? So maybe this is more a question about what's the current standard by which a physician, actually in this case for you, a pharmacist, would think about how to match medication to a patient and that patient's needs?
So right now, typically what happens is many providers, they have sort of their favorite medications. So they will, of course, take into considerations many factors that the patient present with. So you will look at their age, gender, their kidney function, liver function, comorbidities, and of course, financial situation. And you will consider multiple factors to choose the best medication for that patient. However, a lot of that information still comes on a population level. So, typically you have hypertension, or let's try this medication first. So you sort of have your go-to medication. And when that medication does not work, you will go to sort of your second option and next option. So we are usually providers, with lots of evidence on a population level. We try to pick the medication that works best for that specific population. But once again, if that doesn't work, we just go also come back down to sort of a try and error approach. But many times, many drugs do work for patients, but they respond differently. So providers definitely take that into consideration. And sometimes it's really coming down to financial reasons sometimes. When patients cannot afford certain medications, you will actually have to choose a medication that is more affordable. So there are lots of factors that the providers will consider when they choose a drug.
Yeah, so it sounds like a couple of things. One is that providers do lots of personalization as much as they can anyway, and pharmacogenomics is an additional tool to make personalized medication a reality for that particular person with their very specific needs and way they react to drugs. I mean, conceptually, the way I think about this is if we have an Excel spreadsheet with 8 billion entries, the population of Earth, or we can have an Excel spreadsheet with like 25,000 different tabs, and each of those tabs represents a smaller group of people. And eventually we could have 8 billion tabs for each person on Earth, their particular genetic profiles understood in terms of their medication response. So that seems like providers are going to have more tools going forward. Is that what you would say?
Yeah, pretty much. That's exactly right. We have lots of evidence with lots of information that will help choose best medication, and pharmacogenomics, it will be an additional tool that will help you choose the best medication for the patient.
Excellent. Thank you. Great. So next question, Jaden, is how do we know if the drugs prescribed will work for me? This is obviously a big question, but let's say you randomly have to, on a Saturday morning, go to an ER to take care of something, and maybe there's an infection, so the doctor says you need to take a medication. You go to the pharmacist and you go home, take the medication, but how do we know that medication prescribed will work for you?
Yeah, so this is a great question. The obvious question is you will not know until you actually take it. Of course, as a provider, based on all the clinical information and demographic information, as I've discussed, you will take all these different clinical factors into consideration to choose the best medication that will most likely to work for you. So, physicians and the providers, and they try to choose the medication that will work for you based on evidence. However, you will not know that until you take it. So that's really, unfortunately, the only way to find out whether it works or not. But once again, we have different tools to find out which will most likely to work for you.
Okay, so it sounds like kind of going back to our pharmacogenomics, the response to medications conversations is that instead of always reacting, as an individual, as a system, and so forth, we can start to move towards the side of the spectrum where we're actually anticipating some of the problems that we might have, and then we can then get the medications that we need based on that. Is that how you would describe this, Jaden?
Exactly. And that's why I mentioned about the preemptive pharmacogenetic testing. So within the pharmacogenomic community, there is definitely a big push for preemptive testing. That way we can choose the right medication the first time. Because we are always trying to choose the best medication for our patient that will work. Pharmacogenomic will certainly help with that type of assessment to really choose the best medication for them. So, I still think that we are a little bit lagging behind when we're talking about preemptive testing. But I do think that, the future is really preemptive pharmacogenetic testing. So before you even start medication, we want to look at your genetic makeup and the differences to help us guide the right medication for you the first time you need it. So I do think that that is sort of the direction we are going forward.
Yeah, so very exciting. So the transplant community, organ transplant community, I know about pretty well. A lot of them pre-transplant and certainly post-transplant are taking a lot of medications, and knowing ahead of time not to take a medication would be a huge, huge help. So thank you, Jaden, for that. Next question, another big question for you. So how does pharmacogenomics help with the decision-making process for a clinician?
Yeah, so typically when a physician or other providers make a decision, once again, they take many different clinical factors into consideration to choose the best medication. So for example, you will likely start with, diagnosis. So let's say you are diagnosed with hypertension. Well, there are many different classes of drugs that you can use for hypertension. So then the doctor will need to decide, okay, which class of drug will likely be most beneficial. Does this patient have kidney disease? Does this patient have heart failure? Does this patient have other comorbidities that may affect the medication? So you will go through these different sort of approaches to really pick out the medication. And sometimes, and also the financial side is definitely a factor that you want to consider. So usually you have sort of these sort of a checklist or decision tree in your head where depending on the patient's clinical presentation, how severe it is, and also how quickly we want to control the condition, these are all sort of factor into the decision-making process. And of course, pharmacogenomics will play a role there now, where depending on patients' genetic variants. So let's say, for example, let's say you have a patient who just had a heart attack and they need a antiplatelet therapy, and you may consider clopidogrel. Well, we'll probably look at your CYP2C19 enzyme and their functional level to see if clopidogrel is actually appropriate drug or not. So this is additional tool that will help you decide the best medication for the patient.
Great. So when you said a little bit earlier, what really stood out is like, it sounds like this could really help someone with comorbidities. And for some reason, like diabetes came to mind. So someone with diabetes is oftentimes trying to navigate 3 or 4 different things at once. And so pharmacogenomic tool could really help sort out maybe a better course of action for someone like that. Is that how you would describe it? Or how would you characterize some of the comorbidities and helping them with pharmacogenomics?
Yeah, so well, in terms of comorbidities, it is really focused on choosing the medication that will be complementary or it will sort of help both conditions. So, for example, if you have a patient with high blood pressure and diabetes, you will likely choose the medication that have shown benefit in both fronts. So that's sort of what you would consider.
Great. So big question here, and you could just, as if no one has ever heard this before, but maybe they've experienced it. So what are actually adverse drug reactions and are they avoidable?
Yeah, so adverse drug reactions are unintended effects you get from the medication. So let's say I give you a medications to lower your blood pressure. So lowering the blood pressure is the primary intention for giving you that drug. Anything outside of that is sort of consider adverse drug reaction because those are the effects that we didn't intend you to have. I tell this to all my patients that every drug has an adverse drug reaction. Even the medications that we don't think are causing trouble. So, for example, like vitamins, supplements, herbal products, things that we consider natural but in a pill form, they all potentially have adverse drug reaction. Sometimes you may not notice them because they're mild, but I say every drug has adverse drug reaction. And how you avoid it is really to make sure that you get the right medication at the right dose. Because sometimes, even if you get the right medication, the dose can be the problematic side of it. So if you get too much of it, you may get side effects. But at a lower dose, you might be just fine. So sometimes the adverse drug reaction heavily depends on sort of the doses. Now, that goes to, of course, the drug concentration in your system, which can also play a role within pharmacogenomics. So, pharmacogenomics here plays a role to help you choose the right dose or maybe even completely avoid it if you have a system, health system, where you're not metabolizing the drug quick enough so that the drug accumulates too much. So in cases like that, it will help you to sort of choose a different medications to avoid adverse drug reactions.
Got it. Thanks for that. So what really stood out there is that we could define every medication as having a reaction. We only talk about adverse drug reaction when it crosses a certain point, a certain threshold, and start to cause us problems, which is really kind of a fascinating way to think about drug reactions. We always have reactions, but do they harm us or not? That's kind of the big question there, right, Jaden?
Yes. So in addition to that, certain medications, the dose is really not relevant. So some medications, if you have a certain genetic variant, you are just at a high risk of developing severe reaction, whether you get a small amount or a high amount. So definitely there are some genetic variants that for example, like G6PD deficiency can lead to hemolytic anemia with certain medications. So you do need to watch out for that. Sometimes the dose is not the only answer.
Excellent, thanks. So maybe building on that, what's an example of a person who's had an adverse drug reaction?
So I personally had a interesting story of a patient who was taking this like a natural herbal product. I don't remember exactly the name of the drug, but the patient was taking it because she heard good things about the herbal product and the immune system. Later, it was really found that it was toxic to her liver. So she actually had a liver failure and was put on a liver transplant list. That was a very severe sort of a case of adverse reaction. On the other hand, of course, I had cases where when I used to manage a lot of patients with diabetes, they'll take GLP-1 antagonists and they'll have constipation. But the medication works really well. Their blood sugar is good, they're losing weight. So constipation was an unfortunate adverse drug reaction, but it wasn't something that they couldn't manage. But the benefit of the drug, the GLP-1 antagonist was so great that the patient was willing to manage the constipation. So patient will go get laxative or stool softener to help with constipation. So it really depends on the benefit of the drug and how undesirable the adverse drug reaction is. So sometimes you will have to sort of balance the pros and cons in that kind of situation.
Yeah, I mean, I think you gave us the spectrum pretty well, right? Like you can manage on one hand constipation because it helps you on the other side of the medications you're taking, but then this other person, the reaction was so severe they needed a life-saving organ transplant, a liver transplant in this case. So, where would like maybe an example of something between those two extremes?
I think it kind of depends on the clinical situation. So how severe the reaction is and what we are trying to address here. So in certain cases, like I can think of an example as like a metformin. So metformin is another drug for diabetes, and we usually do not give metformin in patients with kidney disease, but severe kidney disease, because it could accumulate and lead to a severe side effect called lactic acidosis. So you really need to sort of monitor the level. So things like that, it really could tip over to one side or the other. So those will be more careful situation.
Great, thank you. All right, so this is just for the average person. They take a medication. How do they recognize something is going wrong? How do they recognize that maybe they're having an adverse drug reaction?
So usually the temporal relationship is the one thing that you definitely want to watch out for. So as soon as you start a new drug, or if your drug's dose has increased, you want to watch out and monitor for any new symptoms that you never experienced before that could potentially help you recognize some of these adverse reactions. But there are certain medications where the adverse reactions are not really time bound. So it could really happen anytime, even if you've been taking medication for years. So in that case, you need to be prudent to be aware of this type of side effect is possible, and continue monitoring this sort of signs and symptoms of this type of reaction. So it's really about keeping a close eye on your body. Of course, you know your body the best, and communicate with provider, because sometimes it might not be adverse drug reaction. You might be developing another medical condition. So having an open communication with your doctor will help you recognize adverse drug reactions.
I mean, what your response kind of tells me, which I know, but also, and I've heard over and over again, is really how central and important it is that we know ourselves and we trust ourselves and we really take full participation in our own healthcare, or healthcare now represented through taking medication. So do you have any examples of a patient who's been really dialed in on their body and getting better at taking medications and maybe being able to get off of medication over time?
Yeah, so there are few cases. Of course, one example is patients with diabetes, especially in the early stage. Because of their blood sugar level was so high, they will be put on a diabetes medication, but they make significant changes in their lifestyles, and then they may come off of the medication. Now, I personally don't call that like a reversal or anything. You still have diabetes. It's just that you're managing diabetes with lifestyle changes. So that's another one example. And the other cases, of course, with lots of mental health disorders. Some of the patients, we have a common misunderstanding that mental health condition is like a lifelong. While some patients can recover, and they can really recover well, that they might not need medications. So that could be also a case as well.
So finally, can you give us a quick overview of UGenome's personalized medication service?
Yes, so we provide at-home personalized medication service. We have an at-home testing kit that will ship it to you, and then you can ship it back to us. And our cost has everything sort of baked into it. Just like you mentioned before, it's a simple cheek swab to collect your DNA sample. We will analyze, and you'll get a result. Not only that, you will get to speak with our pharmacogenomic pharmacist to receive consultation on your medications and how to interpret the data and what you should do going forward. So it is sort of a complete sort of care when it comes to pharmacogenomics. So we think that this can be really helpful for our patients.
Great. Thank you, Jaden. Thanks for taking the time today to talk.
Thank you.